There are many different methods or approaches given by different psychologists. Sigmund Freud, who is also called as the father of psychology, took forth approach of psychoanalysis. You may remember A Patient in the Coach. Over the years, psychologists like Jung, Carl Rogers, Seligman, who wrote their own theories and approaches and techniques to be used for intervention. All these will be discussed later in the course. To show you the entire counseling process, eclectic approach has been adopted. Recent techniques like mindfulness, cognitive processes, etc. are also shown here. You have observed that each counseling session must be a planned activity with specific goals, which we discussed last time. It should have pre-directed boundaries. It is taken very seriously. Otherwise, it may lead to just a casual chat or a conversation. At the beginning of the process, by second session, the counselor should decide on a plan of action, including how and when the counseling process will come to an end. The client has to be informed about when the participation of others involved will be expected. For example, in the case shown in the video, Rupa's father is informed earlier when he will be expected to come and meet the counselor again. This gives the client and others involved to be prepared mentally and be ready to spare their time. The counselor should completely refrain from enjoying the dependency which the client sometimes develops during the counseling process. Making the client self-dependent and not dependent on the counselor or learning to solve his own problems must be the final focus or goal of the counseling process. Observe how the counselor explains the goals for each session and they both mutually decide the plan of action. Now, the counselor is taking the approach of a guide. He or she will explain the plan of action which is mutually agreed upon. Counseling sessions, timing, frequency and the duration are also discussed to suit the convenience of both. Generally, weekly one session of 40 to 50 minutes is sufficient for intervention. After progress is observed, the frequency should be reduced to once in a fortnight and then maybe once a month. In this last video, we observe the changes in the thought, feeling and behavior which has taken place in case of Rupa and her parents. Initially, Rupa's mother was very keen on seeking counseling session, but her father was little reluctant. Oh, you're looking so pretty, Rupa.
Thank you.
How are you?
I'm good.
How are you, both of you?
We are very fine. Thank you, madam.
Absolutely, Rupa is back to normal and we are so relieved. We were very shocked to hear what Rupa had to face and it was so unpleasant to hear that what she has gone through. Thank you so much for helping us.
Yes, madam, and thank you for helping us through the process of lodging the complaint. I hope that the boy has learnt a lesson now and Rupa also will be more cautious henceforth.
Yes, I am sure the boy has learnt a lesson, but it will be nice if we can also talk to him.
Yes,
He is also young like her,
True.
so it would be nice if we talk to him also. And thank God Mrs. Singh brought it to our notice absolutely in time, so that we
Yes.
could deal with the situation without any medication or any further treatment.
Absolutely.
Okay, so how was your dance performance?
It was awesome. Everyone loved my choreography and it was so much fun.
Actually, Rupa is such a wonderful dancer and she is pursuing it back, so I am more glad about it.
Yeah.
Okay.
And I'm more glad about it because my dad was also present at the concert. And
Yes.
So, doctor, now are you able to spend more time with the family?
Trying to, madam. And I remember your sentence that day you told me on the phone that emotional support is equally important to the monetary support, and this sentence has stuck to my mind.
Okay. Family support always makes wonders, doctor. You know?
Yes, true.
So I am happy now Rupa is out of the situation completely. And in future, if you need any help, do come back to me.
Yes,
And
ma'am.
Rupa, we will always be there to help you.
Yes, thank you so much.
Coming to the last stage of counseling, which is the stage of evaluation or termination, or if needed, further referencing. Let us see how it is to be done. We have to take care of certain points here. First is, it is the importance of time bound tapering. It cannot just happen anyhow. It has to be a pre-planned activity, and the counseling sessions must be reduced gradually. Then giving the client the confidence that he or she is empowered now and they can help themselves and not depend on the counselor. Hand holding and weaning, again both these are involved through the process. At one point, gradually the counselor withdraw himself or herself and the weaning starts. Further reference to special educator, therapist, occupational therapist, doctors, psychiatrists, etc., or sometimes in case of the academic difficulties, the remedial teachers should be done at the right time. Assurance should be given that in future the client will be able to help himself or herself, or if needed they can always seek an appointment with the counselor. At the end of the process, do thank the client for their active participation and seeking early intervention, as the participation of the counselor as well as the counselee is both equally important. The counselor must abide by certain principles. Any counselor's integrity, commitment and sincere efforts do take positive effect on the person. We are going to talk about the ethical issues in counseling. It is very important whether you are doing the counseling in a formal manner or in an informal way, counselors must take care of certain principles. Like the first one is about the professional ability. You may have general ability, but it has to be trained, it has to be molded, and certain certification must be achieved before you start practicing as a psychologist or as a counselor. Then there are different agencies which also give you the certification like APA, RCI, BSCP, BPS, etc. And they also give you certain norms of code of conduct which should be followed strictly by the counselor. Confidentiality or anonymity, we have already discussed this, how important it is. This is the most important part of any counselor's job, being 100% confidential. Please do not talk about your client in any social situation or where you do not know the other people, making sure that you respect a person's need for confidentiality all through the process and even later. Then being non-judgmental, cultural understanding of the gender biases, discrimination, respecting individual differences, all these are very, very valuable. Also you should have traditional or cultural ways in which people behave, we should try to respect that. It may be different than your own set of culture or values, but it is still respected. Like global factors like honesty, no false promises, no lying. Many times the novice counselor tend to talk about their qualifications. They are not honestly telling you what exactly the qualification is, or sometimes they make false promises. Yes, I am 100% sure I can deal with this situation, and the client will be completely out of the problem situation. So, that is making unnecessary tall claim. So, actually to some extent it is also considered as lying, and we should completely refrain from doing it. Like there are sometimes undue demands made by the counselors. They feel that the client does not have the right to know about your training, about what methods you are going to follow for the treatment, which is not right. We should be very, very open, very honest about what you are planning to do and whether that is agreed upon by the client or not. Do not make undue demands. Then in this whole process, there is equal right of participation as well as every person has a right to withdraw. Withdrawal plan must be discussed beforehand and it is also explained to the client. Informed consent for treatment, tests, etc. For the diagnosis of a problem, if you need to conduct any kind of testing, if you want to use any kind of checklist, you have to inform the client. If the client is a minor, in their case we should make sure that every theoretical part or any technique that is used, the treatment plan that is discussed, the tests that are administered should be explained thoroughly to the parent, and their consent in the writing is also necessary in some cases. Explain treatment plan, how long we are expecting the treatment to go, whether the duration is of 1 month, 2 months, 6 months, or what is the frequency that is expected. Is the client expected to come once a week, once in a fortnight, once in a month, whatever is your plan, whatever you have planned should be explained thoroughly to the client. Then maintaining timing of the therapy schedule. Many times the counselor themselves do not maintain the time. They feel if I make my client wait for a very long time, he might think, okay, I am so busy and I am so good. But that is not right, because it will affect your therapy schedule and that will affect your relationship also with the client. So, respecting their timing as well as your own timing is important. Then the fees. What is the kind of fee you are expecting the client to pay? The client needs to have a clear understanding whether you are going to give them a bill, if there is any particular procedure that is followed for billing, and it should be explained right in the beginning. Communicating and explaining the results. If you have used any kind of assessment tool, if like IQ, EQ, personality test, etc. tests are given to the client, it is very much expected that you give a written report and also discuss it with the client. It is not just you just assume or you do not say, or you can say it is a screening test that I have administered and only then you may not give the detailed scores of it. But in the normal circumstances, we must make sure that we give the report to the client. Written documentation is very well maintained, which includes when you start talking to the client, include the date and the timing, when the sessions are taken, which is the number of the session, whether the first session, second session, and also what problems you have noticed, what are the brief points you need to discuss further, or what goals have you achieved. All this has to be maintained in a written form. Respect the client's right to be self-governing. We have to understand that each person wants to be self-governing. He is not going to be dependent on you all the time. So, we should make sure that the client is empowered to be self-governing and respect that client's right to do so. Maintain professional distance or boundaries. Now, this is again a very important point. Sometimes counselors need to discuss or they are tempted to discuss how good I treated the person. So, you have to make sure that you maintain the professional distance. The counselor cannot be, he is friendly, he is talking a lot of individual issues, but still we need to make sure that the professional distance is maintained and the boundaries are not crossed. Now, this is also very important for every individual counselor to introspect and self monitor your strengths as well as limitations. If you think that you are falling short at some point, please make sure that you do not overdo things or do not try to portray as I can do this or this is my strength, I can easily handle it. That cannot be done. You also should understand that certain personality factors which are for the counselor sometimes create a limitation. If you are a very sensitive person, you may not be able to handle difficult situations, like if there is an abnormality in a child or if there is some serious traumatic experience that a client has faced. If you are not sure that whether you can control your own emotions and speak fluently, please accept that limitations. In that case, prepare yourself better, expect that okay, after introspection I have realized that this may be my limitations and how I am going to overcome that. Now, this is also very important. Just because some clients are spending a lot of money on your counseling process, You cannot say that, okay, I will give little limited guidance or counseling for this person, and somebody is paying you well, I will give him a lot of counseling. It does not happen. This is absolutely unfair. So, everyone should be very clear about the fair and impartial treatment given to all kinds of clients. Now, to summarize the whole module, let us see that we have concluded the module of the counseling process with the 5 steps which we have already discussed. The first one was rapport building, second one was problem assessment, third one was setting goals, fourth one was treatment or intervention, fifth one was further referencing, in which we also spoke about ethical issues. Hope you have clearly understood how the counseling process is carried out in its stages. Each stage is a well designed with specific goals, methods to be used, tools to be used, different techniques to be used, all that is done with proper decision. Please once again note that how counselor skills of observation of said and unsaid words is important. Then how it is very essential to be used for correct diagnosis. Many times different tests or techniques will have to be used on for the diagnosis, and after the diagnosis is done, SMART goals, achievable, measurable or also time bound goals must be set for each session. Planning and conducting the session with mutual respect. It's not that the counselor is sitting on a high chair and giving advice. Try and make sure that the counselor and the counselee are on the same page, they have the equal rights. Now, how the ethical issues of genuineness and confidentiality or unconditional love and respect for the client and empathy, the key word in the counseling, are most important. As it goes by the Erickson's words, wisdom is not what comes from reading great books. When it comes to understanding life, experiential learning is the only worthwhile way, everything else is hearsay. Experience is the only worthwhile way and everything else is a hearsay. Thank you.